Hello friends, welcome to Creative Medicine. In this lecture, we will learn about a patient with schizophrenia started on neuroleptics. His psychotic symptoms began to improve and then he developed sadness. He would talk less to others and mostly remain in bed. This presentation would be caused by all of the following except. So, here the patient is on neuroleptics, so psychotic symptoms have improved. Number 1. Number 2, he has developed sadness, talks less and remains in bed. So, these are actually the negative symptoms. Okay, these negative symptoms are mainly because these negative symptoms are still persisting. Okay. Second, sometimes on usage of antipsychotics, the patient might develop drug-induced Parkinsonism. If the patient develops drug-induced Parkinsonism, even here the patient might suffer from negative symptoms. Okay. Number 2, these symptoms, that is sadness, talking less, might look like the patient, like the symptoms of depression. So here, these symptoms, negative symptoms, can be due to drug-induced Parkinsonism, major depression, or negative symptoms still persisting. He is acting to external stimulus is false. Thank you and thank you for watching.